Second white coat. Subscribe and like. Let's learn medicine together.
All right, let's jump right into a really fascinating medical detective story. You're about to see how the biggest clues to a major organ problem weren't found in some fancy lab test. Nope, they were hiding in plain sight, right in the palm of a patient's hand.
I mean, it sounds kind of weird, right? How can kidney failure make your hands go numb? The kidneys are way back here. Your hands are, well, they're your hands. But stick with me, because by the end of this, you're going to see exactly how these two parts of the body that seem so far apart are actually deeply connected.
You know, every great medical mystery, it always starts with a person. And this one is no different. Our story kicks off with a patient who's dealing with this really frustrating, persistent pain. The kind that just completely messes up your life. So here's the situation. We've got a 43-year-old woman, and her main problem, the reason she's seeking help, is this constant nagging pain and that awful pins and needles feeling in both of her hands. I mean, just imagine trying to get through your day with that. Simple things would feel totally impossible. Okay, now this is where the clues really start to pile up. First, the pain gets way worse at night, so bad that it's waking her up from a dead sleep. But here's the kicker, the one detail that just changes the entire investigation. She has end-stage kidney disease, and she's been on hemodialysis for a long time. So right away, we know this isn't just some random hand problem. It's got to be a piece of a much, much bigger puzzle. So where do we even begin to unravel this? Well, you treat the symptoms like a map. The exact location, the specific type of pain, that's going to be our guide. It's going to lead us right to the source of the problem. And get this, the pattern is incredibly specific. The numbness isn't in her whole hand. Nope. It's just in the thumb, the index finger, the middle finger, and about half of the ring finger. Plus, we already know it's worse at night, and she gets a little relief by shaking her hands out. They even have a name for that, the flick sign. See? This is not random at all. This is a classic, almost textbook pattern. That super specific map, those exact fingers and no others, they're all connected to one single electrical cable that runs into the hand. And that cable is called the median nerve. Just like that, we've narrowed our search from the whole body all the way down to a single nerve. Huge breakthrough. And when there's pressure on that specific nerve, right there in the wrist, well, that condition has a name you've probably heard a million times, carpal tunnel syndrome. Okay, so we've got our number one suspect, but the real mystery here isn't what it is. The question is why? Why is it happening to this patient? To figure out the why, we've got to look at the where. So let's head to the scene of the crime, so to speak, and take a closer look at the anatomy of this carpal tunnel. All right, so just imagine a little tunnel, right? The floor and the walls are made of your hard wrist bones. They're not going anywhere. The roof is this super tough ligament stretched across the top. And packed inside this tight, inflexible space, you've got a bunch of tendons that move your fingers. And snaking through all of that is our one very sensitive median nerve. The key takeaway? There is not a lot of extra space in there. And that's the whole problem right there. In a healthy tunnel, everything's fine. The nerve has room to breathe. But the second something else starts taking up space in there, if that tunnel gets crowded, that soft little nerve gets squeezed. And that squeeze, that's what's causing all the pain and numbness. Okay, so now for the big reveal. We know the nerve is getting squeezed inside the carpal tunnel. The million-dollar question is, what's doing the squeezing? This right here is where we finally connect her hand all the way back to her kidneys. So what is crowding the tunnel in this patient? I mean, this is the central question of the whole case, right? It's not the usual suspects like typing all day or some kind of injury. No, something else is physically taking up space in that tunnel, and we know it has everything to do with her kidney disease. And here it is, the culprit. It's a condition called Dialysis-Associated amyloidosis. Whoa, that's a mouthful, so let's break it down. It's actually pretty simple. Your kidneys are amazing filters. One of the things they filter out is a waste protein called beta-2 microglobulin. But when your kidneys fail, even dialysis can't get rid of all of it. So over time, this leftover protein starts to build up, and it forms these hard deposits. Think of it like gunk, called amyloid, that can get stuck in your body's tissues. So you can see the chain reaction, right? Step 1, the kidneys fail, so they can't filter out this protein. Step 2, dialysis helps, but it doesn't get rid of all of it over the long haul. Step 3, the leftover protein builds up into those hard amyloid deposits. It's like unwanted baggage. And where does this stuff love to collect? You guessed it, right inside the carpal tunnel. It crowds the space, and bam, it squeezes the median nerve. Now, any good detective will tell you you have to rule out all the other suspects before you close the case. So let's just quickly run through the list and see why other conditions just don't fit the facts here. Could it be diabetic nerve damage? No, that usually starts in the feet, not the hands. What about muscle inflammation? Nah, that would cause weakness, not this super specific numbness pattern. Other big nerve or muscle diseases, they just don't look like this. All the evidence, every single clue, points in one direction and one direction only. And so, case closed. Here's the final verdict. The median nerve was being compressed inside the carpal tunnel, and it was being compressed by amyloid deposits. And those deposits built up because of long-term hemodialysis treatment for her kidney failure. It's a perfect, tragic chain of events. And you see why this is so important, right? For doctors treating these patients, what looks like a simple wrist problem could be a huge red flag for a much bigger issue. It's like her hand was shouting a warning that her kidneys just couldn't anymore.
I mean, what an incredible example of how interconnected our bodies truly are. A problem over here can cause a symptom way over there in a place you'd never expect. It really makes you wonder, doesn't it? What other surprising hidden connections are going on inside us right now, just waiting to be discovered?